something that's near and dear to our hearts. And the last thing I'll say is that I think one thing people forget is that the pregnancy episode is unique in the sense that the average age is 18 to 35, right? So they're young. A lot of pregnancies now are Gen Z, actually, not even millennial, right? So to me, it can be the tip of the spear to help catalyze and transform because they're digitally native, right? Compare that to a senior citizen that could have a chronic disease, right? So I'm hoping there's a ton of opportunity here for pregnancies and improving the quality of care and creating a better world that babies in, right? That's what it's all about.
We're going through something absolutely historic.
Technologies across the board are growing exponentially.
It's a disruption that's going to completely redefine the way businesses compete.
In the next decade, we're going to lose 40% of today's Fortune 500 companies.
The exponential growth of computing is continuing.
AI is nowhere near its full potential.
Whether you like it or not, that the future cannot be stopped by anyone.
Welcome back to the Future Tech and Foresight podcast. I'm your AI host, Mark Verbenkoff's deepfake avatar, and this is episode number 219. Maternal healthcare is at a critical crossroads, where technological progress has dramatically improved infant outcomes while maternal mortality continues to rise, especially in the United States. In this episode, the conversation explores the structural and systemic challenges driving these trends, including access gaps, rural care shortages, postpartum mental health, and the lingering effects of COVID-19 on already strained healthcare systems. The discussion dives into how telehealth and remote monitoring technologies are reshaping prenatal and postpartum care by bringing medical support directly into patients' homes. From connected mobile apps to at-home monitoring kits and virtual clinical teams, these tools offer a way to detect risks earlier, reduce unnecessary hospital visits, and empower patients to take a more active role in their care. The episode also highlights the expanding role of nurses and nurse practitioners in delivering scalable, technology-enabled maternal health support. Looking forward, the episode explores AI's growing role in healthcare, from administrative automation and clinical documentation to decision support and patient interaction. While adoption remains slow due to entrenched business models and incentive structures, the potential impact is profound, particularly in postpartum care. The conversation concludes with a forward-looking vision of how digital-first tools could redefine pregnancy and maternal care for future generations, making it more accessible, empathetic, and effective. Now a little bit about today's guest. Anish Sebastian is the co-founder and CEO of BabyScripts, an innovative maternal healthcare company focused on reinventing the standard of prenatal and postpartum care through the delivery of digital education and remote patient monitoring experiences. Anish has led several evidence-based research endeavors that have resulted in multiple first-in-kind publications and white papers, further quantifying and validating the benefits of the BabyScripts product, including a pilot with GWMFA for BabyScripts' maternal mental health product, which is in beta testing at the site and will be the subject of a focused research study. He is a recognized thought leader in the field of maternal healthcare and technology and a frequent speaker on the future of healthcare.
Anish, thank you so much for coming on to the podcast today. It's a pleasure to get your insights and knowledge about the industry and the work that you're doing. So thanks for coming on.
Thanks, Mark. Excited to be on the pod with you.
Yeah. So I start off every interview with asking the guest how you got into the work that you're doing. I think the audience, as much as they like the insights that the guests bring on, they also like to understand the interesting points or, the events or something like that drew, every professional that comes on into the industry. So if you could start us off with that, I think that'd be great.
Yeah, for sure. The industry that I'm in is healthcare, something that everyone can relate to. But specifically the area that, we focus in on is the episode of pregnancy, right? The miracle of life, if you want to call it that. And you might be thinking, hey, like what's a guy like you, obsessing over that? Well, I mean, candidly speaking, I have my now wife to thank for a lot of that. She's a medical provider, an OBGYN, and delivered babies, right? So, and initially when I was dating her, I was also starting to think about how technology can truly improve the access to care. And she very quickly kind of pointed out, there are some major issues in the in the pregnancy space in the United States and even globally, right? So that got me into the journey, and what started off as a few dates, ended up being a whole relationship, and now we actually have two kids of our own together. And I'm sort of very grateful for the opportunity that we have, and hoping at the end of the day, right, we make the United States, but ultimately the world a better place to have a baby, which I think everyone, in this day and age can get behind, right? So so that was sort of my hook into it. We can certainly talk about the declining birth rate and other issues of getting care and stuff like that, right? But as far as like what pulled me in, it was like my family. That's who I'm very grateful for on this, right? So
Yeah. Yeah. Well, that makes absolute sense. I wasn't going to ask this question, but it kind of percolated into my mind when you were talking. So if I look back into history, and I don't know the numbers, and I don't know if you do either, but let's say 100, 200 years ago, the birth rate was like, or the mortality rate at birth was like 50% or something like crazy. It was really, really high. And I don't know what the numbers are now, but I know it's not that high. It's significantly lower. And what my maybe biased mind attributes that to is, obviously modern healthcare, but technology in general, right? Which you can kind of say healthcare is based off of. Do you know those numbers, and can you maybe add a little point or two to what I just said?
yeah, I mean, I think the infant mortality rate. I don't know the exact numbers going back, hundreds of years ago, right? But it was certainly, um, much higher than it is today. There are some interesting kind of wrinkles into this, right? So I think as first sort of like the major leaps in technology, right? Like, certainly the ability to do a C-section was a big deal, right? The NICU, the neonatal intensive care unit, was a big deal. But interestingly, things like just proper prenatal care, right? Or early prenatal care and postpartum care was also a big driver into this. What's kind of interesting though is that in the the kind of the two big things you look at is infant mortality rate, or really preterm birth rates, right? And like maternal mortality rates, right? So what happens to the mom, right? Those are kind of the two big outcome measures you look at, right? The preterm birth rate has essentially kind of plateaued, right, at about 9% now, right, ish. But interestingly, the maternal mortality rate in the U.S. specifically has gone up. So more moms die in the United States than any advanced country, right? Any first world economy, right? And there's some interesting reasons for that. But that's a trend that a lot of public health officials, technologists, startups, companies, providers of care are definitely kind of looking into, right? So.
Well, I'm super curious as to why that is, and specifically the timeline. Maybe I missed it, but is it over the last 10 years, 20 years?
Yeah. So it's been happening for about a decade or so.
Right.
And honestly, it has kind of the impact of COVID has exacerbated it as well, right? Like it's and look, I do want to make it clear, maternal death is a relatively rare event, right? But those rare events have gone up, right? And you start to sort of ask questions as to, well, what's causing that, right? The two things that we like to point to is number one, right, like lack of proper access to care, particularly high risk care, is a big problem, right? And then the other piece of it is interestingly enough, right, like the suicidality rate in the postpartum time period has gone up, right? And that is part of maternal morbidity. It's a multivariant situation, but that's also sort of driving it, right? So so we think access to care is a big kind of gap, right? And certainly just the overall maternal mental health kind of concept of it is also kind of a big driver of this, right? So so there's that those are interesting kind of trends that's happening, right? In the overall, like, maternal health space, right? If you look at it that way, right? So.
And could you maybe double click a little bit on the access to healthcare? Like, I know the United States has its issues, just like we have, our significant issues up here in Canada. I'm assuming it might have to do with income level that reduces access to care, but I'm sure that there's a couple other variables that I'm kind of curious to hear about.
Yeah, so there's a couple of different aspects to that, right? So the first piece is like you start with looking at rural communities, right, where we've seen just a lot of like community health centers, hospitals, just like straight up shut down, right? And that actually, what does that create? That creates like no place for a mom to go to get care or get see a delivery specialist, right? And that's a problem, right? And then what happens is like you have like these adverse events, right? Like a late term baby, or just other complications, and then you then have to like rush them to a high acuity hospital to take care of them, right? That's definitely a piece of it. But to your point, I mean, I think if you start to look at major urban centers, right, you do have a tale of two cities, if you want to call it that way, right? So you have some of the best care, out of New York City, right? Like, like you have some of the best care, some of the best specialists here, on the face of the planet, right? But at the same time, right, like if you were to look at sort of like the difficulty for, someone that is on shift work, right, and needs to go to the prenatal care appointments, right? For them, they have to take a day off of work and sit in the office and, hopefully see the doctor for a few minutes, right? And then come back and pay for parking, right? They're just, like, I don't know if I can afford this, right? I don't know if I can. So you start skipping some of those, you start skipping some important, biometric measurements, important tests. And then that does create some gaps in care. And that's compounded in the postpartum time period, right? So,
Right.
I think access to care is definitely a big part of this. And like I said, there's like two components to it, right? Number one is like the rural kind of side of things, right? But even in major cities, to your point, right? There's just like kind of two tiers almost, right? Of care, right? So that continues to be a trend that we're seeing, right? So.
Right. Yeah. Yeah. No, that makes perfect sense. You did mention COVID. Obviously, it has come up a lot on the podcast, and I think the podcast actually started just a couple months before COVID, so it kind of enabled me to do a lot of remote calls with CEOs and otherwise that would otherwise be predisposed. Um, with all the discussions about COVID, and I think that kind of one of the main ones is the digitalization of businesses and industries, et cetera. And obviously with that comes, as we're doing here, remote communication, remote monitoring, remote everything. So I would also assume that, and maybe this, is a good segue into what you guys are doing a little bit more, but I would also assume that during COVID and post-COVID, there would be a lot more remote opportunities for, the two groups that you were just talking about.
Yeah, no, absolutely, right. So, I look at COVID as obviously the country and the economy went through a lot of stress and pain, right? But there is some major leaps forward that we made out of it, right? So, yeah, number one is the adoption of remote technologies and telehealth, right? And particularly in pregnancy, you have to remember, right? Like if you had like a knee replacement surgery, right? Like the doctor would just say, you know what, everything shut down. I'm going to push this off 6 months. What you can't do that on is a pregnancy, right? So, there was just almost like an overnight difference between our ability to talk to providers like before COVID and after COVID, right? Like they're like, I need to deliver safe remote care. And I need to do this in a way that's very quick, right? So we saw quite a lot of growth during the COVID time period that ultimately led to some of our ability to get to some funding. And today we have a fully scaled platform that enables providers to remotely deliver elements of prenatal postpartum care, right? One thing that we focus on quite a bit is remote data collection, right? So one data point that's really, really important in pregnancy is blood pressure, right? The higher the blood pressure goes, that's correlated with increased risk of preeclampsia, other signs and symptoms, adverse events, right? So, in fact, a lot of prenatal care, or a lot of sort of what folks go in for is, and getting questions answered, doing some basic tests, and taking a blood pressure, right? Like that's like those are key things that we need to do. We think all of that, or a significant portion of that, not all of it, but a significant portion of it, could be done in a patient's home, right? So, so we have a mobile app that guides patients through their pregnancy. We have a kit that we ship to moms, right? We call it the My Journey kit, right? There's a connected blood pressure cuff, Bluetooth, cellular, right? And the cool thing that we do is that we directly connect all of that information back to their doctor and alert them if something is off track. So the patients are happier because, if you are living 3 hours away from a clinic, right, you don't have to take that 3-hour ride. You can just, see someone through Zoom and use our technology to monitor, right? Similarly, if you are, working at, a job, right, you don't have to take 3 buses and, try and get to to practice or the clinic, right? You can just do it at home, right? So I think the concept of taking care outside of the 4 walls of the clinic into the patient's home certainly exploded during COVID, and healthcare in general was transformed. I mean, even if you go back beyond COVID, right, like telehealth or remote mental health care or virtual mental health care, concepts like Hims and Hers, all these big companies that advertise, right? This just wasn't the case, right? And I think COVID definitely accelerated and catalyzed the adoption of it. And certainly pregnancy and prenatal postpartum care was the big beneficiary of that, right? So
Right. Yeah. So I also want to ask a question. Like, there's obviously the technology aspect of it that I think you started touching on, which you guys are doing. But I think there's also, maybe this is more closely connected to the telehealth idea, where you have like nurses.
yeah,
The last couple times, I'm a pretty healthy guy. Rarely have to go to the doctors, thankfully. But the last couple of times, I didn't even go to a clinic or a hospital or anything like that. I just got on a call with a nurse, and she's like, "Oh yeah, this, and then moved on." So I think that there's also the opportunity, and maybe even more importantly, like the cultural acceptance or the societal acceptance that you don't need to go physically somewhere. You can just pick up a phone, get an answer from somebody that um, offsets, or should I say, saves a doctor's time to focus on other larger things. So maybe just touch on this healthcare practitioner person, and then we can touch on the technological aspect, which I think we all want to dive into a little bit more.
yeah, for sure. And this goes back to the access to care point, right? The reality is there's far less obstetricians in the United States, but also globally, there's a shortage of kind of trained specialists, right? So we want to make sure their time is used for things that only they can do, right? Like, that's an example would be highly complicated management of high-risk pregnancies or a C-section or something like that, right? But if you think about routine low-risk care, and if you think about routine prenatal care, the reality is a nurse, a particularly nurse midwife, can do almost all of it, right? So I think, what has changed is, number one, people's acceptance of telehealth, and number two, people's sort of appetite for that convenience, right? Yeah, if I can just like get on a Zoom call, take my blood pressure at home, and do like a 15-minute appointment with the nurse or nurse practitioner, right? And knowing that there's a doctor kind of overseeing the whole thing, I'm happy. I'm taking that, right? Like, and I can go back to like picking up my kid, or go back to work, right? Or take the meeting afterwards, right? So I definitely think that we're moving towards what I like to call the captain of the shift model, right? Which is, you're going to have one kind of specialist healthcare provider that'll be the captain of the ship, but that person is going to have, let's call, like, really like an army of helpers, right? An army of providers, nurses, MAs, other specialists that can help navigate and get to a better care model. Candidly, I think the US is a little bit behind in the adoption of this, right? It's a very it's a very specialist oriented kind of culture, right? So people want to see the specialist for everything, right? But the reality is, a lot of this care could be delivered effectively by nurses. Right now, I will say that, when appropriate, you need to bring in a specialist, no question about it. So there's a little bit of that delicate balance we got to bring out, right? So, and then we have care navigators and nurses on our team as well, right? That will contact the patient to see what's going on. If there's an issue, be that first level triage, right? So when we can connect them back to their care team, they know exactly what's going on and how to treat the patient.
Right. So is it am I correct in understanding here that, with the advent of telehealth, with this, captain the ship metaphor, you had nurses and other healthcare providers augmenting a doctor's capabilities to treat more patients. And now I mean, before as well, obviously, but now even more so. And we can, talk maybe a little bit more about what you guys do. There's this other level of technological augmentation, if you will, even of the nurses, so that some of their work is taken away and they can focus on even some of the more interesting things, that they can do in a human to human call.
Yeah, that's exactly right. So I think there's an element of all work that can be, completely kind of taken ownership of by the technology tier, right? But it's no silver bullet, right? So there's when that stops, right, then you have kind of the nurses and how their work is augmented by technology. But even at the physician, the specialist level, right, even their work is augmented by technology, right? So everyone is being force multiplied. But then there's some tier of it which is like just pure technology. I'll give you an example, right? So
Yeah.
we have and I'm sure we'll talk about the AI part when we get to the future piece of it, right? But even before talking about AI, right? Like we have a pregnancy journey app, right? That the patients have, right? So today, if I had a question on, hey, can I eat this type of sushi during pregnancy, right? Like normally I'm like trying to call the practice or, maybe Googling online, right? And you don't know the clinical validity of that information, right? So, but now there's an app for that, right? So they just pull it up and they do a search and to get an answer. It's also specific to their care team, right? So it's like, what floor do I need to go to for labor and delivery, right? Boom, it's there, right? So that is like kind of on autopilot, right? And then you go into at the nurse level, it's like, all right, like the patient's already done XYZ before I see them, right? They've taken their blood pressure, they've checked off a bunch of things, answered some questions. That's the augmentation piece, right? And that's also true at the physician level, right? So there's both augmentation that's happening, and then there's also just kind of just tech as being kind of a foundational layer to help automate a lot of things end to end, right?
Right. Yeah, that's really interesting. So it's really this entire pillar of augmentation and putting my brother just had a child about a year ago, right? So, I moved back to Canada. We're involved.
Congratulations. You're an uncle,
Yes, yes, yes. She's adorable and already starting to be a little bit mischievous, so it's great. But, we were obviously on the outskirts, but slightly involved in the whole process. And, it's very chaotic even from somebody on the outskirts a little bit here. The mother obviously takes a lot of effort into doing everything. I think that with an app, with a tool, with these kinds of technologies, um, it's going to be very helpful for them to not have to go and do like 50,000 Google searches.
Yes.
And does that not also reduce the overall stress of the mother as well? Like the ultimate question I wanted to get to, and I don't know the connection part here, but all of this augmentation, all of this support, what's the level of more as we talked about at the beginning, the mortality, the not the I can't remember the technical term, but like the mother's mortality rate. Is that like what's the rate that it's going to reduce with all of this technological tiers, the augmentation tiers, the telehealth tiers?
Yeah, good question, right? So one interesting way to look at this, right? So let's wind back the clock 200, 300 years,
Yeah.
right? Like most of like prenatal care didn't exist then, right? So you'd have these scenarios where pregnancy would just happen, right? Like people would deliver at their home, or their old grandma would come over and coach them through labor, right? Like in other words, pregnancy is a part of life and not this condition, right? Now, about 30% of pregnancies will have some complication, right? So the whole game in this lane that we're in is to identify the signal from the noise, right? And so the reason I say that is if you have a patient that's activated, engaged, and empowered in their care, right? They're like, you know what, I'm gonna my journey kid just came home. All right, put me in coach, right? Like let me take the blood pressure, right? Let me step on that scale, make sure I'm not gaining too much weight, or answer these questions through the app, right? Like there's this natural sort of empowerment and activation that happens that it creates a better mechanism to detect the rising risk, right? That 30%,
Right.
right? So the whole game is to find that 30%. So we definitely think that empowering the patient is a big deal. We think that the patients are going to be the best advocates for themselves, right? At the end of the day. And ultimately, I think the clinicians, providers, everyone else also want that, right? So, we definitely think that just if this sort of truly happens, we should see better quality and outcomes, and as a result of that, a reduction in maternal morbidity and mortality, right? So, now, given that these are rare events, right, it's going to take time for it to like statistically show out, but it's definitely headed, I think, in the right direction. So.
Right. And from the number of healthcare guests that I've had on the podcast over the past couple of years, that seems to be the general trend, right? It's these technologies in whatever specific category we're looking at enables individuals and their doctors to find the issues really before they happen,
Yeah.
so that they can be treated early or dealt with early, so that they don't later on become the more grave situations that many of our family members and loved ones experience. So if you are helping to do that within pregnancy, I mean that's pretty cool.
Yeah, early detection and early detection of risk is it's a big deal. That's a big deal, right? So the quicker you can get it, because you don't have a ton of time, right? So it's like getting that early detection is it just creates a better care model, right? You can say, hey, this patient needs a nutritionist, or this patient needs a mental health specialist. Which is the other thing Bell touched on, right? It's like one other change that is important to mention is that for a while, right, we kind of had this traditional one-to-one relationship, right? You have one doctor, one patient, right? Now it's like this village concept, right? Because in addition to treating the pregnancy, you also have to treat the underlying context that the pregnancy is happening under, right? So, for example, what happens if you are a type 2 diabetic and you get pregnant, right? All kinds of interesting complications. What happens if you are chronically hypertensive, right? And you become, it's like a stress test in the body, right? I remember early on, well, one of the key medical advisors kind of said, "Hey, like pregnancy is a pressure cooker, right? For future health risks, right? In fact, all the data shows this, right? If you become diabetic in pregnancy, right, because it's induced by the pregnancy, you're much more likely to get it later on in life, right? So it's like a vision to the future, for the mom. So then they can actually kind of like coordinate care afterwards. They're like, oh, I need to go see a cardiologist. I need to see an endocrinologist, right? So, so that part I think is also super interesting, right?
Yeah. Again, I wasn't going to ask this question either, but based on what we were talking about, it kind of seems as if a lot well, it seems like with all of this pre-work that can be done, right, understanding the issues before they happen at a larger societal or economic level, like there's going to be some pretty substantial savings, if you will, improvements to society and the economy. I definitely want to separate both of those. I haven't looked at any healthcare reports lately from, McKinsey or something like that. Do you have any, again, random question here, but do you have any like specific numbers of like within the next 5 years or 10 years or something like that, the larger scale benefits? And, obviously you're in the States, so anything specific to the US?
Yeah. So I mean, just in the U.S., right, that there's about 4 million or so births every year. Total spend on an annual basis is about 40-ish billion, right? So it's traditional US healthcare, right? Like spend the most, than more than anyone, right? Now, one of the things that makes it very, very difficult to predict the cost savings as a result of these, the adoption of these technology is that, even with all of the impetus and, with COVID, right? And the cultural change that's happening, what hasn't changed, and it's changing very slowly, is the business model of healthcare, right? So even though like the technology sea change is happening, the incentives are still to do things the old way, quote unquote, for a large piece of it, right? So it's like there's such a tortured problem in some ways, right? So for example, and we don't need to get into the minutia of how things are getting paid for, right? But if I as a physician, right, am not being incented to do remote patient monitoring, even though there's a sense for that, like it's better for the patient and it's better for clinical quality, and the data proves it. It's like I'm already busy, I'm already burnt out, I already have a ton of patients to see.
Yeah.
Why would I do this one additional thing, right? Like, so Anish, I really like you, but like, come back to me when things are different, right? Now, recently things are starting to change, right? So now there are these like codes that you can use for getting reimbursed, and payers are expanding their coverage policy. Telehealth is being reimbursed, right? But the biggest bottleneck in change in healthcare, at least in US healthcare, in my opinion, is not technology, but the incentives, the business models, right? So and that is why healthcare is much slower than almost all industries to adapt change. Some of it's truly tied to like patient risk, right? Like patient safety and patient risk. But there's this old adage, right? Like you could have a cure for cancer, it would still take 20 years for everyone to adopt it, right? So,
Right.
so I think to see a meaningful delta in cost savings, we're talking about like a multi-decade phenomenon, right? And it's not going to be something that's going to happen in near term, right?
Yeah. Well, I know somebody in the audience is thinking, well, just throw AI at it and it'll get fixed. It'll happen quicker. You did mention, we should talk about AI. I do see the time's winding down, so maybe it's a perfect time to kind of throw AI into the question mix.
Yeah. Yeah.
Maybe, well, I mean, maybe I can just get your general thoughts on artificial intelligence and the work that you're doing and healthcare in general, but maybe a couple more specific questions after.
Yeah, I mean, I think my general consensus that AI is definitely a transformative technology. It is the way of the future. The question, of course, is how and when does it transform healthcare, right? Like that's the question I kind of think about, right? And I look at that in like two different buckets, right? Number one is how can AI help automate and create more efficiencies for provider like workflow, right? Let me give you an example. So when you do a virtual consult, right, with a patient, at the end of it, you got to note that consult in the electronic medical record, right? It's like, hey, I spoke to Mark, he's in good health, he looks good, boom, done, right? And that is what's used to submit a bill, right?
Mm.
Um, what's interesting now is that like with all these like AI, they call it AI scribes essentially, right? Or these recorders, right? Like that process is automated or starting to get automated, right? So, the 7 minutes it would take me to jot my notes down and document in the record is now like 30 seconds, right?
Right.
So that is, I think, what I'm seeing as like the first tier of AI in healthcare, which is the administrative like gunk, right? Which is a big deal.
Yeah.
It's like you'll be surprised how much of healthcare works on faxes today, right? Like people fax one office to another, and then someone has to read it and scan it in, right? So that again, with computer vision, I think can be automated, right? So that's the first tier of AI work within healthcare. Tier number two, I think, is like augmenting kind of clinical care through the use of AI, right? So, for example, I'm having a conversation with you, and during a consult, and there's some risk-based algorithm that tells me, hey, you know what, like Mark has a higher risk of XYZ based on some of the data that we're seeing, right? Oh wow, I didn't know that. Let's talk about it. Let's do another test on it, right? That's kind of tier two, and the tier three, which I think will take a long time, is ultimately like the AI nurse or the AI doctor, right? Where you're just having a full conversation with an agent essentially, right? And that agent is taking input, making a decision. Maybe there isn't a human in the loop even, right? And then you go pick up medication at the local pharmacy, or that gets drop shipped by a drone, right? So that like end to end like AI world is a ways away, and I don't know like when that's going to happen, but we're seeing that bottom tier, just the gunks, right? Like the automation. That's where a lot of the focus has been, and we're also investing in some of that ourselves, right? So
And that's happening now. Is it at scale, or is there still some hesitation from, say, doctors and nurses to implement like Otter AI or Firefly, the one that I use, these sorts of things?
yeah, it's not at the same level of penetration as the Zoom recorders out there, right? Now, why is that? Because there's data governance issue, there's technology integration issues. I'll say there's still some general resistance from physicians and administrators on it, but it's way more on the it's that's like in the fourth inning if everything else is in the first inning, right? So it's a little bit further along in that. And this is where like there's like big companies kind of getting into this, or smaller startups getting into this, right? So um, I will say the smaller companies are using this in a much more effective way than the big health systems, right? The government run health systems, right? Like that they're going to take some time to get into it, right?
Yeah. Yeah, to me, it's always so interesting hearing even these smaller automations, right? Like this 7 minutes down to 30 seconds. Okay, it's great, but then you look at it at scale,
Oh,
right?
it's a
Across,
game changer, right?
it's just billions of hours per year, potentially, or at least millions of hours per year. And if we're just looking at the States, like not even talking globally, it's just I get so excited having these conversations, thinking about the next 10 years. And I know that the audience loves this as well. It's like it's going to maybe not completely revolutionize the world, but it's certainly going to bring some pretty massive benefits to all of us, that are going to be able to stick through and live for the next 10, 15, 20 years. It's very interesting, very exciting.
Yeah, I mean, I think there are so many like just real kind of cost savings and impacts of it, but there's also a lot of unintended ones, right? So,
Mhm.
like for example, the number one cause of physician burnout is this stuff, right? It's like they come home, they put their kids to bed. I see this with my wife. She boots up again. I gotta do notes, right? Um, and it's just tiring. And a lot of nurses actually have just like given up on healthcare, right? So if like 20% of their work or 30% of the work is like sucked up, it's great. Today you go to a consult, right? The joke is like the doctor's talking to the computer, not the patient, right?
Right.
Because they're like, oh, let me make a note, right? That's going to change now. You just put a little recorder in there and says, I'm going to look you in the eye and talk to you as a human being, right? So that piece is going to make healthcare a little less intimidating, right? So, and then, yeah, a lot of the administrative spend is going to come down. That means hospitals that run on razor thin margins are now going to be able to invest in clinical quality and care, right? So, and for remote monitoring companies and virtual health and telehealth companies like us, right? Like we can be very quickly like AI native, right? So we can just on the ground up start running into it, right? So from my standpoint, a care manager or a nurse can handle a much larger panel of patients on a monthly basis as a result of these tools, right? And then not to mention the actual sort of clinical value once we get into some of the algorithms, right? So I think that's the long term kind of benefit of this, right?
Yeah, it's so interesting. So you could see hospitals, smaller private clinics become much more profitable much more quickly, and therefore maybe dealing with one of the first things that we dealt with, which is access to care. Right? If you have
Yes.
clinics, I don't know, franchising or creating some new business model or something like that. Um, wow, yeah, it could potentially maybe not fully solve, but it could certainly help out the scenario, the challenges that you laid out at the beginning.
Yeah, I mean, I think I'm a little biased on this, but I think healthcare might be the last industry to be fully
Right.
transformed by healthcare, but it also might be the one that has the biggest impact societally, right? So
Yeah.
it's sort of like the two ends. It's going to be very slow. It's highly regulated, right? So I mean, like the other area where I'm seeing a lot of work on healthcare AI is the use of AI to read scans, right? So think about your MRIs, your CT scans, your X-rays, right? Like that's there's work there, and then one thing that is going to be completely revolutionary is the drug discovery process.
Yeah.
Right. So whether it's, looking for the right like protein or looking for the right biomarker, right? Like you just run a bunch of models through it, right? That's something that takes 10 years, might take, who knows, 10 days, right? So I anticipate we'll see some big leaps in therapeutics and diagnostics in the next in the next decade or so for sure because of AI. And then the delivery stuff we're talking about is definitely going to take longer, but it will be transformative, right? So to the point where think about like, humanoid robots assisting in surgeries, right? So
Right.
and that's real sort of sci-fi, right? But it's happening. I mean, I definitely have seen folks that are like intrigued by it and looking into that or VR based surgery and stuff like that, right? So no.
Yeah, I remember like many years ago it was already sci-fi, and it was one of these remote surgeries, some I don't know, some maybe physician in New York was operating on somebody in, China or something like that, right? And it's that sounded completely sci-fi, and now it's kind of, you talk about it and it's not all that exciting because we've all heard it happen so many times, even though it is still really cool. I don't think we touched on postpartum at all, and I think that that's maybe one of the last things that we should touch on. Um, Maybe you can touch a little bit on kind of what you guys are doing with that. I also want to add in one little thing afterwards, but maybe just
Yeah, for sure. I'm glad you brought up postpartum. I know we drifted a little bit there.
yeah.
I think postpartum is probably the most important, one of the most important areas in all of healthcare. It is also where there's just a lot of gaps, right? So if you think about it, that first 3 months after mom and baby leave the hospital, hopefully mom and baby leave the hospital, right?
Mm.
It's very critical, right? For number one, a very young child, super stressful time period. There's a lot going on. And what happens is you focus so much on the baby, you start thinking less and less about the mom's health. Is the wound healing properly? Are there other complications, hemorrhage, postpartum preeclampsia, right? So we have a lot of programs that focus in on like postpartum care, which is perfect to be done virtually, right? Think about it.
Right.
If you have a 5-day-old at home, right? Do you really want to take that 5-day-old on the metro or the bus, and maybe you're recovering from a C-section, right?
Mhm.
And go in and see a doctor, right? No, you'd much rather do things remotely, and you'd much rather do things, virtually, right? So even things like virtual lactation consulting, virtual virtual mental health care, virtual kind of caregiving, right? That first 3 months is absolutely essential. And then the other part of it is proper transitions of care, right? We talked about how risks that get identified in pregnancies are important to be considered post, right? So both from a pediatric standpoint, but also from a maternal health standpoint, right? Like make sure those things are being taken care of. And if we do that, if we kind of have a true fourth trimester program, right? As I like to say, or as folks always call it, the fourth trimester, I think that might be one of the most important things to, improve the quality of care. It's also where the worst stuff happens, right? Like when you think about death, like almost all of maternal death happens in honestly the first like 20 days after delivery, right? So, um, yeah. So either in the delivery event itself or right after, right? That's the most critical time period. So better monitoring, better visibility, and better connected care during the time period, we think could be a game changer. So we have a lot of programs focused on postpartum care and continue to want to expand on that.
Right, right. And maybe the final question here, which is connected to this, I would also assume that in postpartum care, but really kind of in any healthcare, a lot of the questions are very personal, invasive, intrusive, etc. I would think, like, if I'm putting myself back, like the last couple times I went to the clinic or the doctor, it's like, well, I would prefer to talk to an AI that doesn't judge me as a human does, and I would even be more open with, the situation that I'm in. And I'm sure that if you're going through like postpartum depression, you don't want to be judged as a new mother by a human for not being the best mother. Like there's just multiple levels of where like circles of like, I don't want to talk to a human, maybe talking to an AI would be an alternative, a superior alternative in this case specifically.
Yeah, I think there's a lot of merit to that. There was actually a study done where they looked at responses given by doctors on like emails you can send to doctors versus AI generated, and the study showed that the AI generated response were more empathetic actually than the doctors.
Of course.
Now, look, I by no means want to, kind of begrudge the clinical professionals, right? I think, they're human, right? So if you have a long day and, unfairly you're just being worked too much, right? Like, yeah, you could have a more kind of curt response or kind of direct and more academic response when the AI is, you can fine tune it. It's like, hey, just like lay it out perfectly. And every single time it's going to nail it, right? Now, the problem, of course, is it can be wrong every now and then, and that's a big deal, right? So, but yeah, in that study, they found to be more empathetic. But to your point, right? Like I think this is where like mental health AI apps are starting to, do more, right? Like having, actual conversations. Now there's risk. There's a lot of risk. We know that. I don't know if you saw, but folks, ChatGPT, right? They have these like conversations, and at times it can kind of take you down to the rabbit hole. And
Sure.
there was one, I think, student that ended up committing suicide, right?
Right.
And whether or not it was because of ChatGPT or the LLM was, it certainly led to a lot of news articles, associating them, right? I think net, though, to your point, right? It's a net benefit, right? I think we can use it to create a better flow with patients, with the proper guardrails in place, right? So that's what we should be striving for, right? So, and pregnancy and maternity, absolutely, fall into that bucket, right? So,
yeah. Well, hopefully we see in the next year, or maybe it's already out there. I should double check, but for healthcare practitioners, you can write a quick, non-empathetic email and just click a button, like put in the empathy here and send it off, right?
Exactly. Yeah. We need to augment doctors with a little bit of AI tinkering, right? So,
yeah. Perfect. Anish, thank you so much for coming on to the podcast. Really, really interesting stuff. I'll have your website and LinkedIn up on the show notes. Are there any other things or platforms, etc., that you want people to reach out or follow what you guys are up to?
I mean, yeah, I think website, Twitter, X, and LinkedIn are great. Thank you for the opportunity, Mark. I enjoy talking about healthcare and future of healthcare, and particularly the episode of pregnancy. I think that's near and dear to our hearts. And the last thing I'll say is that, I mean, I think one thing people forget is that the pregnancy episode is unique in the sense that the average age is 18 to 35, right? So they're young. A lot of pregnancies now are Gen Z, actually, not even millennial, right? So they, to me, can be the tip of the spear to help catalyze and transform, because they're digitally native, right? Compare that to a senior citizen, that could have a chronic disease, right? So I'm hoping there's a ton of opportunity here for pregnancies and improving the quality of care and creating a better world to have babies in, right? That's what it's all about. So.
Perfect way to end it. Thanks again, Anish.
All right, cool. Thanks, Mark. Appreciate it.
Yeah.
Well, thanks for listening to this week's Future Tech and Foresight podcast. If you like what you've heard here, there are, of course, a number of ways that you can support the podcast. The best way would be to leave a review on Apple Podcasts or give a rating on Spotify, which you can find a step-by-step explanation for on the futuretechandforesight.com website. Alternatively, feel free to leave a comment either on the episode show notes or the YouTube channel where you can see video recordings of the interviews. And finally, if you are part of an organization that is aware of the disruptive and transformational impact that emerging and future technologies will bring and want to know more, please get in touch to hear about the strategic foresight services that we offer and how we can help future-proof your organization and take advantage of the phenomenal opportunities available to survive and thrive in the future.
A lot of future-shocked people and future-shocked institutions in our society are simply overwhelmed.
Once there is superintelligence,
The fate of humanity may depend on what the superintelligence does.
Science fact is catching up to science fiction.
The first truly intelligent machine will be the last invention that humanity needs to make.
The only scarcity that will exist in the future is that which we decide to create ourselves as humans.
Within a 10-year design revolution, we can have all humanity living the highest standard living anybody's ever known.
Progress is accelerating at an exponential pace, and it's going to reach a point where progress is so fast it's going to be a singularity.
We are probably one of the last generations of Homo sapiens.
Every single headline points to the birth pangs of a Type 1 civilization.